Hello, my name is Nicole Sultanum, and on behalf of my co-authors, I will present our journey with ChartWalk. Before seeing a patient for the first time, healthcare workers may do a study of the patient's record to get acquainted with their health status and concerns. The patient record is a very heterogeneous data set containing notes, lab values, forms, imaging, and so on. That said, the parts that tend to be reviewed first are the text portions of the record. Summary notes, diagnostic reports, progress notes. They are go-to sources because they are really information dense, helping get a quick but also fairly comprehensive overview of the patient. Sadly, though, the more accurate take on text in medical practice is less like this and more like this, in that it's too much all at once. And it's something that puts a lot of time pressure on physicians to read this much in detail, with notes that are hardly standardized and hard to skim, with information scattered across many notes and a lot of repetitive content across these notes. To help with that, past work in clinical text visualization tried to address this with visual summaries of content from text notes. While really helpful for content overview, heavily graphical approaches bear some core disadvantages when compared to text. First, they don't have the same communication bandwidth for details and nuance. And at scale, they are limited to semantic features that are feasible to extract from text automatically. And the use of automation in turn leads to trust issues, given that it's error prone and stakes are high for missing something important here. That said, given the complementary nature of their pros and cons, there is value in assessing how to properly balance the two. In this work, we advocate for a more hybrid design approach, or graphics plus text approach, to strike a balance between the use of visuals and text in order to leverage the best of both worlds. This approach has actually been a long journey for us that started back in 2018 with MedStory, published at CHI, when we first pushed for this graphics and text approach for medicine with a small scale prototype that mixed graphical elements and text in many different ways, as you can see here. But it only supported a small number of notes at a time. After that, as follow-up work, we published Document, another clinical plus graphics and text solution supporting much larger patient records. That said, the focus here was more on customizing information retrieval and dealing with automation, and less on getting an overview of the patient record per se. As such, in this work, we shifted back to the task of content overview, now at scale with ChartWalk. We followed an iterative design strategy that included 2 cycles of design and evaluation, plus a set of formative interviews that collectively gathered feedback from 19 healthcare workers in mental health and critical care, some of which participated in multiple rounds. I'll briefly walk you through this latest journey that begins from visualization design requirements we collected in our previous work, including providing means to get an overall picture of the record, temporal awareness of events in the medical history, means to rearrange content around particular facets or perspectives, and to provide extensive access and shortcuts to the original text. Since these requirements were derived from studies with general practitioners, we talked with folks in mental health, a very text-heavy medical specialty, and asked about documentation-related challenges around their practice. More details in the paper, but we basically confirmed that our design requirements still hold for this practice. And so we created a first version of ChartWalk as a minimum viable product to fulfill those design requirements at scale. It features a mentions view on the left to provide good starting points to the exploration, with a 2-level hierarchical list of occurring mentions organized under type, and then by body system and by issue, and organization scheme informed by past work. For a second level of overview, a curated snippets view contains text highlights with select information from notes that provides a bit more detail and context than just a list of terms. There's also a modified calendar view with rows for months and markers for days featuring notes that helps convey temporal patterns. See, there's a clear uptake on the number of notes in recent months, which is not a good sign. To learn more, we can locate a discharge summary to read more closely, which are the orange markers that you see here. After skimming that discharge summary a bit, we may want to make more pointed investigations on symptoms. Back to the left, clicking on a mention replaces the curated view with a search view. And the calendar view also updates to show when the searched term was mentioned, so temporal patterns are still visible. And direct searches can also be used to locate things on the overview panel or search for completely new terms. To evaluate this design, we recruited 11 healthcare workers for quick feedback sessions. Among actionable findings, we found that many participants found the mentions view valuable for overview, but some found it overwhelming, so expand it with better navigability. And also some temporal awareness was missing to discern which mentions were current and active issues versus historical ones. And so the mentions view was expanded with more categories and a better compartmentalization. And each mention was augmented with a sparkline, showing frequency of terms over time and indicate which issues may still be current. Third, some participants found that the system was still very note heavy, which points to a need to make snippets and notes a bit less daunting and more visually organized. The snippets view was redesigned with a new organization level for episodes of care, which are basically intervals of hospitalization. The calendar view was also updated to show episodes of care, which are the gray strips that you see under the day note markers. And the note view now has bolded headers that are automatically detected to help skim notes faster. Fourth, participants wanted to discern other note types beyond discharge summaries and suggested using color for that. The calendar day markers are now colored based on the note types they include, as conveyed by the legend that was added on top. A bar chart to the right of the calendar view shows the number of notes of each type on that month to help better convey note density. The calendar view can be sorted reverse chronologically, and content can be filtered out of the calendar in snippets view by toggling note labels on the legend, which helps locate notes a little easier. And finally, participants were very positive about the idea of selecting snippets of their own to revisit later and to share with others. So we figured this was a good thing to offer moving forward. Content can be curated directly from the text. The yellow segments are curated highlights, which show up in this dedicated highlights panel under the snippets view and are basically pre-segmented sentences and text notes that can be toggled on and off. For this second study, 5 healthcare professionals were recruited to evaluate ChartWalk version 2, where apart from their feedback, we also looked more closely at how the tool changed their workflows. What we found was a very diverse set of workflows as showcased by the variety in usage patterns here. That said, they all started the same way, by reading the latest discharge summary. While not always a complete picture of the patient, it's often a good initial one that can be complemented by the overview and the search features. Now, even those who use the overview features a lot said that it was really important that the whole overview to detail spectrum was supported and that transitioning between them was easy. Following, participants continue to be very positive about curation. That said, some issues may arise when you consider levels of sharing in collaborative spaces and the management of highlights over time, all questions which need further investigation. And finally, participants appreciated the formatting with the bold headers, which leads us to consider ways that skimming can be better supported via other typographic features, more navigation aids, and so on. So what have we learned? First, we can probably agree that reading isn't going anywhere. Text is powerful features. Healthcare workers are trained on it, and we should be leveraging that power, such as VIS skimming strategies, for example. I think there's much that could be achieved with it. Also, spotlighting recent active findings. If there's no time for the history, physicians still need to at least know what's an active concern, so something to flag more explicitly. And fourth, expand curation. We just talked about it, but what I didn't mention is how curation as an interface feature could serve as a nice segue to automation. Beyond using it as training labels for summarization modules, having the metaphor within their tools may mitigate resistance from users when automation is finally introduced, because it is already part of their workflows. On a different take, participants mentioned the tool could help them a lot when writing their own notes by reducing the burden of lookup. So we wonder if tools like this could perhaps contribute to less bloated medical documentation in the long run by making it less critical to repeat findings from past notes. And finally, we argue that the tool could also be repurposed with some tweaking to be used with patients and to help mediate conversations about health, which may foster transparency in patient report. Last but not least, you can try the tool at chartwalk.cs.toronto.edu.